Welcome to my YouTube channel. As you all know that we were discussing about different topics related to contact lenses. So our today's topic will be about the indication and contraindication of different contact lenses. So first of all, we have to define what are the different indication and what is the meaning of indication. Indication mean a condition in which a contact lens use is permissible or a patient is able to use a contact lens in a safer way, and this sort of a contact lens use will not create any sort of trouble for the patient, and the conditions in which this contact lens will be more suitable for that particular patient. So a thorough examination of each patient history, that why patient want a contact lens and what is his previous background, either he was already using a contact lens or any other optical aid and something like that. And then a medical condition is also very important because uh, in certain medical conditions a contact lens use is not safe, and if patients still want to use a contact lens in that particular medical problems, that contact lens can create a trouble or can create a complication for that patient. So that is the reason that medical condition is very important before deciding either a candidate is a suitable one for a contact lens or not. Then expectations and responsibilities of the patient, the refractive need of the patient, and the response to trial. So this is another very important point which tell us about the suitability of a contact lens use for any patient. Then a fitting determines whether a contact lenses are appropriate or not. When you have decided and when you have checked each and everything, you have examined the patient completely, then you can determine that either uh, he is an appropriate candidate for a contact lens or not. So moving on, what are the different indications of contact lens? So we have divided the indications into further three categories. One is an optical indication, second one is cosmetic or prosthetic, and the third one is the therapeutic indication. So let's discuss all of these indications stepwise. First one is an optical indication. Optical indication means this is a sort of indication in which we prescribe contact lens to our patient in order uh, to correct any optical error of the patient eye, and obviously that optical error could be any refractive error, like it could be a myopia, hypermetropia, astigmatism, something like that, in which he or she is unable to see clearly because of this optical defect or optical error, and we want to prescribe this particular sort of a contact lens in order to correct the uh, that particular optical error, and to provide a better vision to that particular patient. And most contact lens wearers fall into this group. So this is very common sort of indication which we normally practice in our daily routine. So moving on, what falls under the optical indication? Myopia, hypermetropia, astigmatism, presbyopia, keratoconus, and isometropia, unilateral aphakia and nystagmus after refractive surgery or after the keratoplasty or a corneal transplant. So we will discuss stepwise what is myopia. As you all know, myopia is a condition in which patient is unable to see clearly at a far distance. So in order to correct this condition, we can prescribe a contact lens, and particularly in hyperopia, if you want to improve the vision of a hyperopic patient, you can prescribe a contact lens. Same goes for the astigmatism, just to correct the vision of a patient, and then a presbyopia, in which patient need distance as well as near correction, and we can correct this particular condition by prescribing a multifocal contact lens. And then comes a keratoconus. Keratoconus is a specific kind of condition which actually create irregular astigmatism, because keratoconus is something which is a non-inflammatory ectatic condition in which the patient's cornea bulges out and it creates a very high irregular astigmatism along with myopia. And in this condition, simple glasses or a soft contact lens cannot be able to correct the refractive status of the patient's cornea. So if you want to improve the vision of the patient, we need a specialized kind of contact lenses that could be in a form of a corneal GP lens, that could be in a form of hybrid contact lens, or that could be in a form of scleral contact lenses. So moving on, we have anisometropia. Anisometropia means patient is having a different sort of refractive error in his both eyes, and the difference is more than 1.5 diopter in any form. And if anisometropia is high, there is a huge difference between the refractive status of both eyes. Obviously, this condition cannot be corrected with the help of regular glasses, because the glasses can create a huge image difference, and that causes anisoconia, and patient will not be able to have a binocular single vision. So in order to correct this condition, we have an option in the form of contact lenses, and contact lens will provide a better vision to the patient, and he will not experience any sort of anisoconia in contact lens compared to glasses. So next is irregular astigmatism. We have still 3-4 indications remaining, which we are going to discuss in coming slides. So we have another sort of indication which comes under the optical indication, that is irregular astigmatism or mild corneal scarring. This is something which is once again related with a sort of ectatic corneal condition, and you will see this sort of condition more commonly associated uh, with the keratoconus, particularly in a stage where a patient develops a corneal hydrop, in which we see a sort of a paracentral scarring as well. So in this condition, if you want to improve the vision of the patient, we have an RGP or a scleral contact lens, and by using these specialty lenses, patient will experience a better vision, because these lenses will help out by eliminating the abrasion, corneal abrasions and glare, and ultimately these lenses will provide a better visual acuity uh, if you want to compare the visual status of these lenses with the normal glasses. So RGB lens better provide a vision, especially in irregular astigmatism, or which is associated with corneal scarring. So moving on, we have unilateral aphakia. Unilateral aphakia means uh, crystalline lens will be absent in one eye. That could be congenital, that could be acquired, surgically induced, or trauma related. If patient is having a unilateral aphakia, he will experience an isoconia if you want to prescribe this patient with regular glasses. So if you want to correct the like an isoconia of the patient, and you want to provide a better visual experience to your patient, and if the patient is child and you want to prevent that child to develop amblyopia in an eye where there is an aphakia, the better option will be a contact lens, and that contact lens could be in any form. You can either prescribe a soft lens or a GP lens. It depends the status of the cornea as well, along with the problem with his lens. So why we prefer contact lens compared to glasses when a patient is having a unilateral aphakia? Here you can see, normally in unilateral aphakia, it actually induces significant disparity in image size that we call anisoconia, and anisometropic correction with glasses produce intolerable and in and isoconia with a difference in image size of approximately 30%. And this difference in image size could be reduced to approximately 7% if you want to fit this patient with a contact lens. So contact lens will definitely be a better option for the unilateral aphakia. So moving on, we have another condition called nystagmus, in which we see a patient is having a jerky eye movement, and if you want to fit this patient with glasses, uh, as we all know, the visual status will be different uh, in terms of glasses. When patient want uh, to to see clearly by using glasses, he will experience a different visual. He will experience different vision from the center and different vision from the periphery as well, because the thickness of lens will be different when we move from center toward the periphery. And if you want to provide a better visual experience to the patient having nystagmus, you can better correct this patient by prescribing a contact lens. The reason behind, contact lens offer advantage over glasses because contact lens follow the movement of eye. Whenever patient want to move his eyes from down to upward or from left to right, obviously he will see a sort of abrasion or a sort of vision related issue if he is wearing glasses. And all of these issues will be eliminated if he is having a contact lens in his eye, a powered contact lens, which is according to the need or according to the prescription of the patient. Patient will experience a good vision because the lens will be moving along with the movement of the eye. So in the patient of nystagmus, if you want to achieve a better visual experience, obviously contact lens will be a better choice compared to glasses. So moving on, we can also prescribe a contact lens after refractive surgery. As we all know, refractive surgery is basically done in order to remove the glasses. And after the refractive surgery, we know that the central part of the cornea becomes flatter. And if any patient has undergone for any sort of refractive surgery, PRK, LASIK, or anything like that, or SMILE, but still after the surgery, if he is still have any sort of refractive error which uh, was not corrected with the refractive surgery, the remaining or residual refractive error can easily be corrected by prescribing any contact lens. And what sort of contact lens will be suitable? Once again, it is dependent on a sort of refractive error which is still not corrected, and we want to correct that refractive error if there is uh, only a spherical refractive error, which is the residual one that could either be corrected with a soft lens or with RGB lens. But RGB lens is the more better one because this will provide a better oxygen permeability to the cornea, because this is something which is an operated cornea, so we want to provide a better oxygen to the cornea in order to maintain the physiology. So GP would be a better choice. And one thing that is important is we have to wait for 3 to 6 months after the surgery. So once the cornea is stable, you can move on and you can go for a contact lens fitting. Along with that, as we have already discussed, that after refractive surgery, your cornea will be not prolate anymore. It will be more like an oblate shape, where the central region will be more flat and the peripheral area will be more steep. So if you want to fit this cornea better, so you have to go for some advanced contact lens design, and that would be a reverse curve lens or oblate design contact lens will better correct the uh, or better fit on this particular cornea. So if you want to fit a patient who has undergone any refractive surgery, so a rigid or a RGP contact lens would be better, but you have to go for a reverse curve or an oblate design contact lenses where you can better fit the cornea. So moving on, we have another indication, that is a penetrating keratoplasty. If patient has gone for a penetrating keratoplasty or a cornea transplant, and still after a transplant he or she is not having a good functional vision because of any corneal irregularity that is induced because of the sutures, still you have a choice of a contact lens in order to provide a better vision, in order to correct the residual regular or irregular astigmatism. But before fitting a patient who has a corneal transplant, we need to wait at least 3 months, or sometimes we need to wait for 6 to 12 months, depending on the condition of the grafted cornea. If the cornea has healed completely within 3 to 6 months, we can go for a contact lens. And what sort of contact lens would be better? Once again, it is dependent on the requirement and on the type of the refractive error, which is residual, and we want to correct that refractive error. And the very important thing is the the health of the grafted cornea. So better choice is you have to go for a GP lens, because whenever there's a cornea transplant, it means cornea need more and more oxygen, and if you compromise the oxygen at this level, the patient can experience graft failure as well. So we have to keep this thing in our mind, and we have to go for that option that will not compromise the oxygen permeability toward the transplanted cornea. So you either have to wait for 3 to 12 months, or normally we need to wait at that time where the suture, all the sutures has been removed, or sometime if the sutures are deeply buried and it's not prominent at all, and it's not creating any sort of trouble for the patient, we can still go for a contact lens fitting. A sort of lens will once again depend on the health of the graft and the type of refractive error which is residual and we want to correct it. But GP would be a better option, corneal GP, or you can also go for a scleral contact lens as well in these conditions. So moving on, we have a second type of indication, that is a cosmetic or prosthetic. So both of these are something closely related with each other along with some sort of differentiation. So what is a cosmetic indication? Cosmetic means you just want to change the color of a normal eye. If patient is not having, or a person is not having any sort of abnormality in his eye, but still he or she just want to change the color of eye, you have the option of a cosmetic lens, which normally we see that a lot of ladies are using just to attend any event, and they just want to change the color of their eyes. So we always go for a cosmetic lens in these conditions. But what is prosthetic lens? This is also a sort of color lens, but the indication is pretty much different compared to cosmetic lenses, because prosthetic lenses are primarily used in order to improve the appearance of the disfigured eye, particularly if there is any sort of abnormality which is present in the patient's eye, and that abnormality could be either related to cornea, either related to sclera, or either related to iris, and we just want to change that disfigured appearance of the eye, we can go for the prosthetic lenses. So what are the different kind of prosthetic indications which can be improved by prescribing or by fitting a prosthetic lenses? So first thing is microcornea. So microcornea mean if a patient is having the diameter which is shorter than a normal diameter, which we normally see in a normal population. So just and the other eye of that particular patient cornea is like normal, then you just want to improve the appearance of that eye which contains a shorter cornea, you can fit this eye with a prosthetic lens. So what is a clear pupil prosthetic lens? We have two different kind of prosthetic lens available in the market. One is a clear pupil and the second one is black pupil. Basically, prosthetic lens is a type of a painted contact lens which contain different sort of color. Either it could be brown in color, it could be black in color, it could be green in color, depending on the type of patient eye color which you are going to match with. So black pupil is something which we normally prescribe to a patient who just uh, want the cosmetic appearance of the eye, but we are not going to deal, or we are not going to provide any sort of visual improvement to that patient. So black pupil means the complete area of the lens is painted, either its center or its periphery. Pupillary area is also painted with the black color, and the peripheral area is also painted with the different kind of colors depending on the color of the eye which you are going to match with. So black pupil is something in which mostly we fit black pupil prosthetic lens to those patients in which we just want to match uh, the color of the eye. And if you want to improve the the vision of the patient as well along with the color of the eye. In that particular condition, we have to go for a clear pupil lens in which the peripheral area of the lens is painted but the central area is clear. So the rays of light are actually going to enter from the central area or from the pupillary area into the patient eye, and that will ultimately contribute to the improvement of the vision in that particular patient. So if the microcornea, if the patient is having microcornea, but this eye is functional eye, this is not the blind eye, then along with the improvement of the eye of that particular patient, we are also interested to improve the vision of the patient, and we are not interested to block the vision. So in that particular eye, we will fit a prosthetic lens that contains a clear pupil. But if we are going to fit a patient who is having a corneal scarring, and if the cornea is densely scarred at the central visual axis area, obviously this person will not be having any sort of functional vision. So we are just interested to hide this scarring of the cornea. So in this particular condition, we can fit this patient with a black pupil prosthetic lens. So moving on, we have a thusical eye or phthisis bulbi. As we all know, this is a shrunken non-functional eye. In this particular condition, we will only go for the prosthetic black pupil lens, where it will just improve the appearance of the eye and will not contribute uh, in terms of visual improvement. So moving on, we have iris coloboma or aniridia. What is iris coloboma or aniridia? You can see here this is iris and this is aniridia and this is coloboma. In coloboma, we have just a portion of iris that is missing, and in aniridia, we have a complete missing of the iris in a particular eye. So, as we all know, that in coloboma or in an iridia, patient experience a light scattering, and that will ultimately create a glare, and patient will not be able to function well visually when he or she will be in a sunlight. So in order to improve this glare of the patient, we can fit this patient with a prosthetic eye, and that prosthetic eye will be a clear pupil, because we are not going to block the vision of this eye by uh, fitting a black pupil prosthetic lens. So we also improve uh, the appearance of the eye, and along with that, we are also interested to improve the vision of the patient, and we are also interested to improve the glare of the patient. So in coloboma or in an iridia, we always go for uh, a prosthetic contact lens that will contain a clear pupil. So moving on, we have amblyopia patching, in which we just want to block the vision of normal eye in order to improve the amblyopia in the affected eye. So we will fit this eye with a black pupil prosthetic lens to block all the incoming rays of light that will not enter into the patient's eye, and patient will only be able to see with the other eye, which don't contain any prosthetic lens. So moving on, we have ocular albinism. Once again, this is a light colored eye, contain a less pigment, and this will also create uh, a glare or a photophobia when patient will be in the sunlight. So in order to improve the photophobia and glare, we can fit an albino patient with a clear pupil prosthetic lens in order to control his photophobia or to provide a better vision. So this is albino patient, this is aniridia, this is coloboma, and this one is a lens which we normally fit in order to improve the amblyopia. So this is a sort of a lens which we normally fit in amblyopia. So moving on, we have the third kind of indication, that is called a therapeutic indication. So what is therapeutic? As the name suggests, it is something which need to be prescribed to to those patients where we are interested to protect the cornea or heal the cornea. If the cornea contains any sort of disease and we are interested to improve or to heal the cornea in a better way, in these circumstances or in these conditions, we can fit this cornea with the therapeutic contact lenses. So what are the therapeutic indications, or what are the different corneal disorders or diseases in which we can uh, fit a a therapeutic lens? So corneal abrasion or erosion, dry eye, or different sort of corneal dystrophies which are associated with epithelial defects, then a bullous keratopathy, then a postoperative pain. Uh, this is commonly associated with PRK. refractive surgery in which the epithelium is like removed, and as we all know that corneal epithelium needs some days in order to heal again. So in these particular days, we can fit this patient with a therapeutic or a bandage contact lens, um, at least for those days in which are normally required to like regenerate the corneal epithelium. So once the corneal epithelium is regenerated, we can remove the bandage lens. So let's discuss all of these conditions stepwise. The first thing is corneal abrasion. As we all know, whenever there is any trauma which causes a corneal abrasion, and corneal abrasion is something which is very a painful condition for the patient. The reason behind, whenever there is the corneal epithelium is compromised, it will ultimately expose the deeper corneal nerve endings, and when we blink, up a little bit irritate the exposed nerve ending, and this will create a sort of pain for the patient. So in order to provide a protection or sort of barrier for that particular pain, we can fit this patient with a bandage contact lens. The next one is a dry eye. If patient is having a severe dry eye due to any like systemic disease like Georgian syndrome or something like that, we can fit this patient with a different kind of contact lens. Especially, we normally practice scleral contact lens for advanced dry eye condition. This provides a better ocular comfort. So this is another indication. And we are having different kind of epithelial basement dystrophies where these conditions are associated with epithelial defects, and whenever there is epithelial defect, condition will be very painful for the patient. So in these circumstances, we can fit a therapeutic lens to provide a better comfort and better healing. Then a bullous keratopathy. This is something which is associated with the pseudophakic eyes. Whenever there is a damage or a trauma to the corneal endothelium, this will create a sort of a fluid-filled pockets or embolies that are once again very much painful for the patient. So in order to prevent the patient uh, to experience this sort of pain and to just provide a better healing, we can fit this patient with a bandage contact lens. So we have already discussed about the post-operative pain. This is something which is associated with the photorefractive keratectomy, a sort of refractive procedure in which we fit this eye with a bandage lens for the better healing of the corneal epithelium, and then a trichiasis or dystrichiasis. So we know trichiasis is something in which there is a misdirection of eyelashes that ultimately rubs on the corneal epithelium, causes corneal abrasion, which ultimately causes corneal ulceration and scarring. So here we need a bandage contact lens as a preventive purpose. So if we want to prevent this cornea from a corneal abrasion or a corneal ulceration, we can fit the patient having trichiasis or dystrichiasis when where there is an extra row of eyelashes that ultimately can touches the corneal epithelium. So if we want to protect the cornea in these circumstances, we can fit these patients with the bandage contact lenses. So moving on, we have some more indications where the patient is non-tolerant to spectacles, especially when there is a trauma, and the trauma uh, can disturb the shape of your face, can disturb the nose, or different can damages the different bones of your face. In these circumstances, patient will not be able to wear glasses normally because glasses will not be fitted properly on these sort of traumatic faces. Here you can fit these sort of patients with different kind of contact lenses. Once again, what sort of contact lens will be suitable for these kind of patients? This is once again dependent on the type of refractive error we are going to like correct. Moving on, if there is any sort of skin disease and if there is any skin problem in which patient is not able to wear glasses comfortably, and if that skin condition is very much closer to the eyelids or very much closer to the nose or very much closer to the ear, these areas are very much uh, associated with the sort of glasses which he or she will going to wear. So in these circumstances, you can fit this patient with the contact lenses in order to correct their visual problems. Then moving on, if patient is having any sort of allergies that are associated with the spectacle frame material, so these patients can also be fitted with the different kind of lenses. And then if a patient is not having one or both ear, so in these conditions, obviously, patient will not be able to wear glasses. So, and still, if you want to correct a refractive error of that patient or any other corneal issue, then you can correct this patient with a contact lens. So moving on, we have certain contraindication of contact lenses in which contact lenses are not suitable to to use or to prescribe to those patients. So what could be that contraindication in which contact lenses are not suitable for the patient? So contraindication could be ocular or general. Ocular means something related to eye. General means the patient contain any systemic issue that can ultimately affect the contact lens use. Obviously, this sort of patient will not be suitable one for a contact lenses. So what are the ocular contraindication? Any inflammation or infection which is limited to anterior segment. Not only anterior segment, even it, it also includes the ocular retina as well. If patient is having any blepharitis, if patient is having any conjunctivitis, keratitis, epicycleritis, cycleritis, uveitis, all of these conditions will not be the suitable one uh, for a contact lens use. So we have to just examine the anterior segment thoroughly, and if we see there is any sort of inflammation or infection present, so obviously that person will not be the suitable candidate for a contact lens use. You can see many other conditions as well, including allergy, dry eye, pingicular, pterygium, many conditions uh, that are associated with the problem in which patient will not happily use for contact lens for a long enough time. So moving on, if there is a corneal hyperesthesia, corneal sensation is not normal. In these circumstances, contact lens use is not the suitable one, because whenever there is a corneal anesthesia or hyperesthesia where the corneal sensation is reduced, obviously contact lens can cause a corneal ulceration, corneal abrasion, corneal erosion, and ultimately patient can experience a sort of a complicated eye infection or corneal scarring or other blinding conditions as well. So moving on, if patient is having uncontrolled glaucoma, then this patient is also not suitable for a contact lens use. The reason behind is particularly patient is having a secondary glaucoma when there is any sort of inflammation or infection, which is the main contributing factor for an increased IOP, then this condition can be aggravated more if patient can be shifted to a contact lens. So this patient is also not suitable one. Then a psychological intolerance to the placement of a foreign body in the eye. Basically, contact lens itself is a foreign body. If someone is having a psychological intolerance and he is like more resistant or more sensitive to a foreign body, obviously he will not to adjust to any sort of contact lens. So this sort of patient will also not a suitable one, and thus it's the major contraindication for a contact lens use. So moving on, we have some general contraindication in which there is some general body problem which ultimately limit us to prescribe a contact lens to any patient. So if person is having any sort of systemic or allergic illness that affect the eye, obviously that will exacerbated by a contact lens use. If patient is having any systemic allergy and that is also associated with the sneezing, itching, watering of the eye, then this patient will also not a suitable candidate for a contact lens. Then if someone is unable to or unable to follow the instruction for cleaning storage of the contact lenses, obviously this is also not a suitable candidate for a contact lens use, because mm, you have to pretty much follow the instruction routine of your practitioner. If you are not following and patient is having any compliance related issue, then that patient will not be suitable one for a contact lens use, because ultimately this can create a complicated or a severe eye infections. So if patient is not following your instruction, you have to limit that patient to use any sort of contact lens. The next one is a poor personal hygiene. Obviously, hand hygiene, personal hygiene is very important. Eye is very sensitive tissue. If your general hygiene is not good, you are not the ideal candidate for a contact lens use. Otherwise, if still you want to wear a contact lens by practicing poor personal hygiene, then obviously you are more prone to get infected. Then the number four is inability to understand the risk associated with contact lens use. If you are not interested to understand the complications or the risk which are associated with contact lenses, obviously you will not follow the instructions provided by your eye care or contact lens practitioner, and that person will be more prone to get any sort of serious eye infection, or that is not suitable one for a contact lens. The next one is if someone is having a low refractive error, and that particular patient is reluctant to use glasses, then obviously if a refractive error is very low, if someone is having only 0.25, zero point 0.5 or 1 or 1.25 diopter refractive error that is spherical in nature, I would suggest that this patient should wear glasses. Or if refractive error is very low, like it's only 0.25 or zero point 0.5, he or she actually don't need any sort of refractive correction. So I don't think so in these conditions you could prescribe a contact lens to a patient. Then if a person is immunosuppressed, obviously that is more prone to get infected by using contact lenses. So these sort of patients are also not suitable one for a contact lens use. So moving on, the use of systemic medication that may cause change in the quality of the tear film. So some medicines are more associated with the dryness of the eye. So these medicines are like, if someone is using these medicine, so that person should not be prescribed with a contact lens. Otherwise, he or she will be more irritated when they want to use a contact lens. Particularly if someone is using any steroid in any form, using anti-glaucoma drug, using antihistamine drug, all of these patients will not be the suitable one for a contact lens use. The next one is pregnancy, nursing, menopause. All of these conditions are something which is related with the refractive instability. So in these conditions, we normally see there is a sort of uh, change related with the corneal sensitivity, and these patients are also associated with the variation in the refractive error. So we have to wait till the refractive error is stable, till there is the recovery of their corneal sensation, and then we can go for a contact lens fitting. So if someone is pregnant or lactating, you have to wait, and once their corneal parameters, their ocular parameters are stable, then we can move on with the contact lens fitting. So moving on, very old or very young patient who cannot manage insertion removal or a contact lens care without assistance. So these patients will also not the suitable one to fit with a contact lens. If someone is very young, like you want to fit a child who is under 6 year, under 5 year, under 4 year, obviously this child will not be able to manage contact lens better, will not be able to insert or remove contact lens better. And if someone is very old and he also contain any general problem, body problem, any disease as well, like if he or she is having tremor, if he or she is having arthritis, obviously this sort of patient will also not the suitable one to prescribe with a contact lens until they have any sort of assistance in the form of son, in the form of wife, in the form of parents who can manage their contact lens care and their related insertion and removal. Then you can go with the prescription or fitting of a contact lens. So that was pretty much it for today's lecture. So if someone still have any sort of question, you can comment down. I'll be happy to answer your queries. Thank you so much.